be a significant work of art. So I think it's a really important statement, and especially since Mary and a lot of you here have done some work with art. I think that that's a fabulous statement. Here's what she is a year later. So that's Emily, that's 12 months later. So let me just see, which person do you think is happier? There's Emily. If they were next to each other, two photos, you would not think that they're the same person. Yeah, so now this is a story about the power of nutritional density. So it's now, and before I say that, I should say though, it's never really about the food. I mean, I've seen alcoholics get better from gastric cancer, and you might want to ask, well, what are they drinking? But the truth is, I think health and healing come from a higher place than what we put into our bodies. But I also do believe that it's important to talk about nutritional density. And Emily is a really good example of this. She's writing a book about this now. She began to realize, after doing a lot of reading and struggling with weight for a long time, that there's a lot of problems with the standard American diet. And if you look at the research on this, it's actually shocking. And I'll tell you, I've been to med school, physician, you think I would know some of this stuff? I didn't know it. I didn't know anything about nutrition. And in fact, I had awful habits going through med school, residency, my early years as a physician. And the truth is, we just don't study nutrition in med school. And there's always a brownie and a piece of pizza in the nurse's station, often. So the truth is, one of the largest epidemiological studies that was ever done is called the China study. And there's a book about it, there's a lot of research around this stuff that's been published. But they found out that when you export the Western diet, the typical Western diet to other countries, it's not just that rates of heart disease, autoimmune illness, depression, cancer, diabetes, autoimmune illness, it's not that these things go up, they go up exponentially. And so there's something about what we put in our food in this country, or what we call food, that's a problem. And I spoke at an international eating disorder conference for therapists, and I was actually shocked that they don't know this either, because I saw the obsession with food and the kinds of food that were being served, and I am realizing that in my profession and scattered across many of our helping professions, we just really don't understand nutritional density. And so these people with recoveries like Emily have been teaching me these things. I think it's the enriched flours, it's the white sugars, it's the chemicals and some of the preservatives that we put in food that are actually disease creating. And I know that in my own personal life, as I've learned some of these things and started to follow it and watch the weight melt off, and I lost 37 pounds and just don't have to even worry about a lot of the illnesses that people get as they get older. And I think that it's worth understanding this kind of stuff. There's a writer who I think understands this stuff really well called Joel Fuhrman, F-U-H-R-M-A-N. He's written a book called Eat to Live. He's also written a best-selling book called The End of Heart Disease, another book called The End of Diabetes. And you talk to these people and watch not just their physical symptoms lift, but also their depression and their anxiety and these kinds of things. And I read this book initially, I thought it seemed pretty radical, but now it seems like common sense to me. And I think what happens is that we eat a lot of these foods that don't have a lot of nutritional value. The body craves nutrients, macronutrients, micronutrients, phytochemicals. It craves these things, and so it triggers the hunger mechanism, and we get hungry and we eat. I think when one understands the power of nutritional density, it's fascinating that our body just kind of finds its normal weight. You can eat more than you ate before. Weight is just not a struggle anymore, and your body gets what it needs. And so many other issues that can become a problem as we get older just don't seem to become an issue. And I think it's an important story. And although she talks about it as nutritional density, I think we also have to realize there's more to it than that. I mean, the statement to decide that she wanted to be a significant work of art reflects such a respect of herself and her body, and I think it was some shift in that was also critical for all of this, because initially it was such a huge change in her life that she had to just really want to make happen. And I think that's something that we need to study a lot more in medicine and psychiatry, is what helps us just wake up and want this, want something, and educate ourselves enough to know how to get it. So that's Emily. Fabulous story. Now let's talk about more of the typical cases I'm writing about. The story I'll talk about now is about a woman named June. She was diagnosed in her early 20s with an illness that basically calcifies your spine and your body starting in the pelvis. And so basically, and there's no cure for it, and you basically are calcified eventually into increasing and progressive immobility. Your pelvis freezes, and then it just goes up your spine and freezes your spine. And she was told, and it was a careful diagnosis, we have all the medical records, it's accurately diagnosed, and this is her future. So, told that, and her response to that was, she absolutely accepted the diagnosis, she absolutely rejected the prognosis. And let me show you a little. So she's got letters in here from her doctors saying that she's definitely cured. But this is June. And for somebody, she's now in her mid-60s. She had the illness for about 2 years before it's not present anymore for her. She did a lot of work. Let's go through here. But you tell me whether she looks like she's immobile. This is in her 60s. Not bad, huh? Anyone want to try this? I can't do it. So she's got picture after picture here. She has complete freedom of movement, vital and happy. And what's astonishing is, in these stories, every single person I've talked to, and I've talked to well over 100 people at this point, and they're all so grateful for the illness, whether it was pancreatic cancer or glioblastoma multiforme, which is a brain cancer, or ankylosing spondylitis, all these different illnesses that people can have, and they are so grateful in retrospect for the illness because it so fundamentally changed their relationship with themselves. And so it's never really so much about the food. That's not what they glow about. It's not what people really want to talk to me about. It's how they really changed the way they experience themselves in the world. So June, she did a lot of things. She did a lot of yoga. I think the yoga was, my hypothesis is that she probably was breaking a lot of the calcifications by doing the yoga. And so that's part of it. And then she was doing a kind of energy work, Rolfing, which I'm not very familiar with Rolfing, but she said she was doing the Rolfing in order to go more deeply into the yoga. So she was doing that. She did make a lot of nutritional changes as well. And then she talked, and most of the people that I study, they talk about these psychological things, and that's why I think we could call this, if we call Emily's story the power of nutritional density, we could call this story the power of emotional nutrition. And what June talks about is how she was doing this energy work and doing the yoga very intensely, and then one day she, in the middle of a session, she had this cathartic experience emotionally, and she remembered back when she was 12 years old, 10 or 12 years old, somewhere in there, she had been at her aunt's house. Her aunt and uncle were getting a divorce, and it was Thanksgiving, and her cousin walked into the room, and I think it was her mom who said, that girl's swinging her hips way too much for a young girl. And it made it really clear that June was expected to be a good girl. And she wanted to be a good girl, she was real compliant. And years later, in the context of all of this, she had this emotional experience and she thought, wow, the freezing of my hips and the liberation of my hips, there's something about that story and about being a good girl versus being a real person that was, and the experience that she was good as she was and didn't have to act a certain way, but that there was something unconditional loving that was possible and available to her, that she could love who she was unconditionally and not, it wasn't about whether she was a good girl or a bad girl. There's something in that cathartic experience that she thinks was very liberating. And that's what you see, that's what I've seen over and over in these stories, is that people will have this experience and they'll realize that they've been judging themselves, that they have felt not good enough in some ways, and that's fundamentally related, I think, to the illnesses that people then suffer from, whether it's something that is psychological or something physical. And I think the big gap between mind and body that exists in modern medicine and is now coming down over these next few decades very rapidly is going to help us begin to see all of this a lot more clearly. So that's June's story in part. I could tell you lots of stories. I could tell you lots of things. At McLean, not too long ago, we had a woman come in for a family meeting, and she sat down with her daughter. Her daughter was hospitalized at McLean, and she was telling her daughter all of these things, and she was telling me some of her own history. You know, 2 failed marriages, long history of just awful physical, emotional, and sexual abuse as a child, raped repeatedly, years of heroin, cocaine, all this painful stuff, domestic violence over and over again. But then you see this calm, happy, peaceful woman talking to you, and I'm going, okay, this isn't matching up. Tell me what happened here. And she said that 12 years ago, she had started to take her psychotherapy seriously for the first time and actually take care of her mind and body, and not just talk about things, but actually take care of her mind and body. And in doing that, she then started yoga. And this one day, she could tell me the date and the pose she was in, and I don't know a lot about yoga. I think she called it the child pose. She kept telling her daughter, you gotta do the child pose and you gotta do yoga. But she said, on this date, it was like the curtains opened and she realized that she'd had a profound misunderstanding of herself her entire life. She'd always thought that she was a screwed up individual, not good enough, couldn't measure up. And she said she realized it was a misunderstanding completely and that she was okay as she is. And she then left and integrated that new understanding of herself into her life. Shortly after, she met the man who was sitting next to her there. He adores her, he treats her fabulously. They've been married for 10 years now. She has a job that's just gone from success to success. And she integrated this new self-understanding into her life in a way that really healed and balanced something in her. And I thought it was just a really touching story, because you see these kinds of things over and over again, and we need to help each other understand that we don't want anyone, a psychiatrist or a doctor, to tell us that a lot of it's in our heads, but actually it is. And that's the opportunity. And I think the future of medicine and psychiatry will be to see that as an opportunity, because we all have so much more to offer. We have so much more inside of us that we have any clue about, and how to wake up to the dignity, the unrepeatable goodness and magnificence of who we are, and realize that we're not the past. And I think there's more healing capacities than we realize. Medications will help us tread water. They just don't give you a life. And we all need and deserve a fabulous life. So I am going to wrap up. I think if you're interested, you can look at my website, medicineofhopeandpossibility.com. It tells some of these stories, and there's going to be more stories being put on there. There's also, my partner is giving a TED Talk on November 11th, which will probably then be published on the web around December 10th or 11th. And in that, you're going to see the first ever, do you know what TED Talks are?
Yes.
Okay, so it'll be the first TED Talk ever that has a hologram on it, like 20 or 30 feet high, so it should be a pretty big spectacle. And it's associated with our effort to provide something that's healing for people. A lot of what promotes illness and prevents healing is associated with being in a chronic fight or flight state. Is that something that I could talk about a little bit more if people wanted to? Healing mode is more a parasympathetic mode. When we heal, we are in a parasympathetic, relaxed mood where we can experience positive, elevated emotions like happiness, love, gratitude, and that sort of thing. And it's just a company that we're trying to help people get into a parasympathetic mode so that healing can occur. Chronic fight or flight prevents healing. So anyway, I don't know if any questions. I can answer a few questions if you want. Yeah.
Where were you born? Where did you go to high school?
I was born in northern Indiana and went to high school at Columbia City Joint High School.
What high school?
Columbia City Joint High School.
Ohio?
Indiana.
Oh, cool. Thanks a lot. Really good speaker.
Thank you. Thanks. Any other questions? Yes.
You mentioned about someone that had glioblastoma.
Yeah.
How did they heal?
So I've got 3, maybe 4 cases of that. So they healed in different ways. Which story should I tell? There's a guy named Pablo in London, and what he did was kind of extreme and not something to do lightly. Actually, I'll tell you 2 stories about glioblastoma multiforme. One story is one you have to be really careful medically because he basically went on an extreme ketosis diet. And so cancer feeds on sugar, especially on the fast-acting sugars that's in a lot of our foods. It feeds on the white flours and on the normal granulated sugar that's in a lot of things. So that's what cancer cells love. They just eat that stuff up. So he basically said, okay, if that's what it is, after he did a ton of research, he said, I'm going to starve this cancer to death. And so he eliminated all of the fast-acting sugars from his diet and basically put the body into a state. It's a pretty extreme diet. He took a lot of supplements, and he did it with the supervision of his doctor. And he basically had a lot of discipline, and he starved the cancer to death. Now, that's not the way everybody does it. I'm not sure I'd recommend it. He also did a lot of other things, but that's the way he talks about it. He had a very strong will to live. I think nobody can, you just can't, the will to live is such a huge factor of what helps people get better. If people have a reason to get better, it's amazing what's possible. So I'll talk about Matthew. Matthew had glioblastoma multiforme. Both of these individuals were diagnosed by biopsy, so we know we had the right diagnosis. Matthew, I'm definitely going to tell his story in the book. It's a fabulous story. So he was diagnosed by biopsy with glioblastoma multiforme. It's the worst form of brain cancer you can get. Average length of life after diagnosis is between 2 and 6 months. And he went to Brazil and saw this healer, but that's not the whole story. He did a ton of meditation and he fell in love. And you see these stories of, and the photos of him and his now wife. He was diagnosed in 2002 with glioblastoma multiforme. I just talked to him again a week and a half ago because I'm re-interviewing people now for my book. He's fabulous, he's very healthy. He's married to her now. They have 2 kids, I believe, and are living in Brazil but are moving back to the United States. And for him, it's a story really about the power of love. He really, I think, replaced a lot of fear with love and meditation and nutrition, and you can't help but notice how much he glows as he walks down the street with the woman he loves, you know? I think he had a really strong will to live. I don't want to say, now see, we're talking about some big things, and I'm talking about all of this very simply. you can't just say, if you do these things, you're going to get better from your illness. Because I think that you just can't get into a situation where we start to say, well, if you do this, you're going to get better. We can't judge things that we don't fully understand. I think what we can do is study people that did figure this out and start to understand the factors that are there, and over time we will understand them better and better, and we can develop ways to help people more deeply get into these healing states of mind. So, there's very briefly 2 stories. Yeah.
I think you're obviously on the right path. I understand where you're coming from, but in all your studies, have you pinpointed the trigger in someone that brings them to the point where they're going to take over? What gets them?
Take over their treatment?
Yes, for their life.
Yeah.
What is it?
Say your question again, then I'll repeat it to everybody.
Well, I'm trying to figure out at what point does someone take over their own life?
Yeah, it's a really good question, because these deep well springs deep within the soul or the deep recesses of the heart, what makes one person decide that they're going to get better and another person, we don't fully understand that. I can tell you in my work, for example, at Good Samaritan Hospital, I see people who die a lot, and I see people who will have a spouse who will die, and 6 months later, you see a lot of spouses follow their partner. I mean, you see this happen a lot. You know, or what you see is you'll see someone diagnosed with end-stage lung cancer, and they'll say, I'm not dying until I see my daughter walk down the aisle. It's just the way it is. And I'm telling you, they don't, you know? And yet and there's other people that they'll be diagnosed and they'll say they want to live, but you can feel that there's something shrinking inside of them, and they give up and die. Now, I think the decision to live versus the decision to die is a very individual thing, and none of us can really know what's going on in a soul, you know? I think we all have our own path. I think that there's, you know, you have to really pay attention to the stories, because, you know, I saw the friend of a brother not too long ago. It's the brother of a friend of mine, diagnosed with gastric cancer, and you know, he'd had a really difficult life and struggled with alcohol for years and had been miserable. His own father had been diagnosed with cancer 10 years ago and basically said, I'm tired of dealing with these problems, I'm done. And it was the end for him. And I think for Miguel, it was very similar. It'd been a tough life, and I think he'd lived in a stressed, anxious state for many years, and there wasn't a lot that he was looking forward to. And I think it was the end of the road for him. And you have to respect that. I think there's not a lot of easy answers for some of these things. I think when somebody's diagnosed with a fatal illness, we can't decide for them what's right for them to do. And we don't know their path, we don't know what's right for them. I think we need to do really careful, respectful research that looks into these factors, but we also have to have some respect for the sacredness of each situation, because every situation is completely unique. Yeah.
No, I think there's 2 decisions that a person has to make. Is they make the decision to live, and then they have to make the decision to do the things that they have to do,
Right.
the life changes to continue to live. And
Yeah.
that's one of the hardest part, because
Yeah.
that's what you have to do for the rest of your life.
Oh,
A lot
yeah.
of people say, I'm gonna fight this, and yet 6 months down the road, they're tired of fighting.
That's so
But
true.
For me, you know, I made the decision that I was gonna get better, but it's a continual
Yeah.
fight, everyday fight.
Yep.
And that's
Yeah.
the hard part.
Yeah, I was talking to a person, it's a really good point. I was talking to a person named Anita Morjani last weekend. She gave a great workshop at the Omega Institute in New York. I don't know if you've ever heard of that. And she is a woman who was diagnosed with cancer, and she was end stage, was in an ICU, and they said she's not gonna make the night. She had tumors all over her body, and was in a bad way, and they said, because she was already in multiple organ shutdown, her liver, her kidneys, multiple organs in her body just weren't working. And I'm not writing about this in my book because I'm staying away from some things that are, might be a little bit much for some readers, but the truth is, for her, she had a near-death experience and realized that she was unconditionally loved, and she came back into her body, and we have all the medical evidence that shows that her tumors were 70% gone within a week, and cancer was completely gone from her body in 3 weeks. And she's got quite a story. If you want to read her book, it's called Dying to Be Me. And she realized, in the context of that she had spent her life being a people pleaser. She had spent her life doing things for others, but she had no clue about what was great and important for her to be doing with her life. And she came back and she had to do the work that Mary's talking about. She had to integrate this new experience of herself into her life. She actually had to move to a different town because she would have friends saying, "My daughter was just so sad that you didn't come over and spend the afternoon with her." And Anita had this history of doing lots to help her friends and to babysit for her friends' children and all these things. She actually was a very sensitive person. She actually moved to a different town so that she could form new relationships on a different foundation where she didn't have to take care of others all of the time. And so that often happens. It's complicated, right? When you really change as a human being, you need different kinds of relationships. And you need better boundaries. You need people who want you to be you rather than to serve their agenda. And that requires some big changes, and it gets a little messy sometimes, frankly. So that's her story. It's just a fabulous story. It's so clear. Dying to Be Me by Anita Morjani, and she talks really exactly what Mary's talking about there, the need to then, after you have this new experience of who you are, to actually integrate that new experience into your life, which creates a lot of uncomfortable situations because you either have to change the way you are in your current relationships or you have to form different relationships. So that's the nature of growth, sorry to say. So maybe it's just easier to take a medication. So,
Nope.
Any other questions? Yes. Yeah. Yeah. Right. Really? Yeah, we have a long ways to go for sure. Yeah, palliative care, people, the nurses especially, are much more holistic a lot of times, much more person-centered in a way that's beautiful. And people have all kinds of experiences that then, I think, talk to the nurses about, and there's a lot we could learn from there. Any other questions?
Could you
Yeah.
just repeat some of what she said? We couldn't hear over here.
Yeah. Do you want to use this?
Oh.
I'm just having trouble hearing too because it's really loud right
Yeah,
here.
a lot of noise out there.
So I have, through the years, worked as a hospice nurse. I work in a jury psych unit now up in Natick. And, but for the years that I was working as a hospice nurse and as well with doing a lot of discharge planning, one of the things that I found that was really a disconnect was when a patient would receive the diagnosis of, that you had a limited time from between now to whatever, and they felt that there was, I think, loss loss of any sort of life or, you know, joy, that sort of thing. So I think it's our job as families and physicians and nurses and whoever is there to provide hope so that they, you know, to have the best path that's left to them, just like for all of us. But I think there needs to be a better support system in place as people transition, whether they're, no matter what age you are. And you know, I mean, I work on a unit that has, it's Jerry Psych, but it's the older unit, and it's age 55 up. So, and we, you know, and they're all like, hey, wait a minute. But you know, I have people who are 95 who are just now trying to figure out, you know, at 95, well, okay, just because maybe they only have 6 months and they are now 95 doesn't mean that the next 5 months shouldn't be really great. So I think it's, I mean, and I think having worked in hospice, the stories and the people are amazing. Some of the coolest, I mean, I actually wound up with a, one of my patients who it was very hard to get in and get her trust and that sort of thing. We wound up actually adopting her cat after she passed away, and Fluffy became part of our household. You know, I encourage people to spend time with your families if you have people who have limited time, because that's going to help that.
Yes, that's right.
Thank
Yeah.
you.
Thank you.
Anything else? Yeah.
Yeah, my name's Kim. I actually work with Dr. Rediger. I just want to tell an experience. I was 75% third degree burned in a fire, and was at that point where I had decided I was definitely gonna die. And they had shared with my entire family that I was gonna die. And in some type of a psychotic state, I had an experience where my father kind of said to me, I was saying to him, I can't do it any longer. And he said, no, you know, you're Kylie, we're fighters. So I just so believe in what Dr. Rediger is talking about, that so much of it has to do with your mindset, because I could tell you that these physicians at UMass Medical Center would not believe that I'm sitting here today, alive, with my 21-year-old son, working with Dr. Rediger. So it's important stuff.
Yeah, well, for those of you that don't know much about burn patients, if they say that that's the most painful way, and it's the most painful unit in the hospital, because you were essentially burned over your entire body. And you spend, if you're burned like that, you spend months in the hospital, and if you do survive it, which many don't, the daily treatments of dressing changes are beyond what we can put into words in terms of pain. I mean, people scream, and you hear the screaming down the hall as people go through it. And so to survive that and decide that you're going to survive it, you can't. Where someone finds that reservoir of strength and determination, you can't prescribe that. So it's quite a story. Anyone else? Yes.
You talked about the importance of people not living in fear any longer and
Yeah.
so on, and how important that is in terms of fight and flight response
Yeah.
and so on. What about people in situations where they can't control that fight
Yeah.
and flight response? Say there are neurological problems that cause them to constantly be in that state. How do you help?
Yeah, that's a really good topic. It's a great question. It's a big topic. There's different kinds of fear, right? I mean, if you walk across the street and you don't look both ways, I mean, we want our kids to have some fear before you cross the road, right? And you want them to realize that when they're 2 years old and climbing up the stairs, that there's a healthy fear there. What we really need, we need more words, right? Because there's a good fear, a healthy fear, but there's also a fear that puts you into chronic fight or flight. You know, if there's a tiger, you want to be afraid of it and you want to make a good decision, right? But if you're living your life, like I think many do in modern life, where you're chronically stressed and chronically secreting the stress hormones, the cortisol, the epinephrine, the adrenaline, and so your body can't heal and your mind can't heal, then how do you help reduce that? So once one is clear that one can create a reasonably safe life, then we have to start teaching people how to get into more of a healing parasympathetic mode. And there's different ways to do that. Sometimes medicines can help with that temporarily, but I think we over-rely on that to help people develop real coping strategies and ways to genuinely relax at a deep level. I think there are ways to do it, and different people do that in different ways. We've talked a little bit about the power of meditation and yoga to do that. I hope that this company we're starting that is going to be an app that helps people see whether they're in chronic fight or flight, and then helps train themselves into a more relaxed parasympathetic state. I think we're just now starting to develop technologies along those lines. Heart rate variability is a future technology that can do a lot. So there's even the neuro EEG stuff. There's some theoretical and practical technical hurdles that need to be covered and improved with that, but there are technologies. As quantum physics comes into modern medicine, we're going to see the capacities of technologies to help with that. And we're right on the cusp of that, and there's just now starting to be a few of those kinds of apps and devices released to the consumer market, but they're not perfect yet. I think the stuff down the road will be a lot better, but I think what we will do in retrospect, we'll see that the age of traditional science and medications was an era, but as quantum physics comes in and we start to have the ability to use neuro EEG to access and relax structures in the brain that are deep in the brain and not susceptible to medications or even talk therapy, which is where this is going, I think then we'll be able to make more genuine progress, and people will be able to train themselves into deeply relaxed states that doesn't require 30 years of meditation. We'll be able to do it much quicker, and that stuff's starting to happen now. It's all because quantum physics is coming into medicine, and that's a whole topic we can go into, but that is the future, I believe. And I think heart rate variability and eventually neuro EEG will probably be really helpful pieces with all of that. Because it's working with energy more than medications, and that's a different era. Yes, okay, so we should wrap it up. All right, thank you all of you, you've been fabulous. I think this peer-to-peer stuff is really magnificent. Thank you.